Hey everybody, welcome back. It is hump day. We are halfway through our week 6 of working from home. And if you are new here, my name is Ivana. Every day at 11, I bring you some interviews and the latest of what's happening in the state during this pandemic. Today, I am joined by Dr. Rendi Murphree. Now, she is Mobile County Health Department's Bureau Director of Disease Surveillance and Environmental Services. That was a doozy, Doctor. But she is here today to tell us what is happening in Mobile, explain some things that y'all have a lot of questions on, and I think a lot of people do. And Dr. Murphree is just going to give us kind of the current status of what is going on down there in Mobile County. Now, Dr. Murphree, I know that you are a very busy person, and I appreciate you taking your time to come on and explain to us what is happening in your county and the things that y'all are doing there. So thank you so much again. For our audience, if y'all have any questions, please feel free to leave them in the comments. I will get them to Dr. Murphree, and if she can't answer them, we will do our best to get you the answers that you need as soon as we can. So Dr. Murphree, thank you again. And first, just give us a little bit of an update about what is happening in Mobile County today regarding COVID.
Yeah, happy to do that. So, Mobile County is a little bit behind the rest of the state with break. Alabama reported their COVID-19 positive case on the 13th of March. Mobile County first reported on the 9th. So we have noticed that we're a couple of days maybe behind. We really had the first epicenter of the outbreak in the state, but people have begun to ask me, why do we have more and Jefferson County when they have a larger population, and why do we have more deaths? And so we feel like we have a lot better testing now than we had several weeks ago. I think everybody is able. In the first couple of weeks, it would take sometimes 5 or 7 or 10 days to get it, and now most people can get results back within really allows us to pinpoint cases are occurring and find out who they've been, and if they've been in a congregate setting, really focus a lot of energy on slowing congregate settings like centers and assisted living, that sort of thing. So we have, we think, go ahead.
I think we've got a little bit of a delay, but what I was going to ask you is, you mentioned something about nursing homes or retirement communities. What is the health department doing to ensure that these outbreaks do not spread from nursing homes and make that problem even worse going forward?
So we've been preparing as a healthcare community for many years. So we have a regional healthcare that for many years has been funded through the CDC Emergency Preparedness Program, and we work with the state health department. We have our own emergency and nurse who have been coalition, hospitals, nursing home facilities, law enforcement, dialysis centers, in our community that touches care or health provider. We've been planning and exercise together and talking routinely in the years leading up to when a hurricane happens, for example. We mobilize and open medical shelters together, not just as an agency. So we're doing those COVID outbreak to study what we needed to do when it finally came into the community. Now that it's here, it's really due surveillance. So all of our 7 facilities in the Mobile County area, we have been in contact with all of them, just find the latest guidance from CDC all the time, and we need them to stay up to date. Talk through, they know whom at the health department to contact if they suspect they have a cluster of respiratory facility. Make sure they have testing material so that if they have a patient, resident, or employee that they can test them a production of the virus and quickly physically the people who are sick to the population to slow transmission within their facility.
And
right now we have
I think we have a bit of a delay. I didn't mean to interrupt you. I was just asking about, you mentioned we're having a little bit of a trouble hearing you, but I think that you were saying that you were talking about getting testing in these nursing homes or other places where there are a lot of people in a close proximity, and making sure that there is not a spread from one person there. If one person has it, you can put in measures to contain that patient or resident. So what is the status of widespread testing in Mobile County right now?
Well, we have pretty good capacity. County Health Department just this week tested who met the criteria, sick worker, someone with an underlying medical condition that might make them at vacations, or anyone that had a condition. So the Mobile County Health Department has a drive-through facility in our downtown Keeler location where anyone who wants to get tested can come and stay. We're very excited about that. I've been a little bit surprised that we've not had long lines. It hasn't gotten out, but we've available Monday through Friday. And then we have heard that the corporate Walmart has contacted our local leaders about setting up drive-through testing. And I believe it's going to be in Saraland, probably open next week. And then I'm not sure if you've caught the news. FDA and I believe LabCorp just announced that the FDA has approved a test for COVID-19, which is if they can produce that any physician who wants patient tested or believes he or she should be tested, that they may not even have to leave their home, able, very soon to get us to their home, collect it, and then ship it back and get those test results and just stay in the safety of it. Exciting. Again, that was just announced yesterday.
But right now, y'all are focusing on that. You said that drive-through testing, hopefully some sort of partnership between the Walmart and maybe Saraland.
I think it's going to be the Walmart corporate headquarters is talking directly with city leader, the leaders in Saraland about how it's going to work, that sort of thing. But we expect that probably open next week. But in addition to these locations, we do have the at Ladd Stadium in Mobile, our urgent care centers that are able to test, hospitals are able to test, there are private providers that are testing. So we think to test for everyone who needs it in Mobile County. We may be needing to do a slightly better job getting of where people can go, if they have insurance, that sort of thing. Because right now we're not overwhelmed with people calling us wanting to get tested. So we need to locations a little bit better so that people.
And there's a lot of talk. Yesterday, Mobile reached 710 confirmed cases. I don't know if that's still the number today, but that was yesterday afternoon. That's surpassing Jefferson County, which is the most populous county in the state, for the highest case count. And Jefferson County is, like we mentioned earlier, a little bit bigger than Mobile County. So this is some, I guess, not very great news for the county regarding the virus. No, you're fine. We're all working from home.
Sorry, hold on.
These issues.
I know. The lady who wants to come and walk our dog for us today just showed up. So sorry. That's why my dog got very excited because
problem.
his best friend, his best dog. Sorry about that.
That's fine. Mine are outside and quiet for now, but our audience knows they like to bark at the most inopportune times. So I was just going over some of these numbers from yesterday about, there he goes now, about Mobile County reaching 710 confirmed cases on Tuesday afternoon. And that's the first county in Alabama to top that 700 number. So what are the numbers looking like in Mobile today? And what is the health department doing to ensure that those numbers don't go higher?
Yeah, so today we're at when I report, the data cuts off at 7 o'clock the night before, that we can have all of the information sort of tabulated so that make a report on first thing in the morning. So as of 7 o'clock last 726 cases of COVID-19 disease. Of those hospitalized, that's about 12. And then we who were classified as died from COVID-19, that's about 4. There have been 2 changes made this week that are important to keep in mind. One is the Centers began to report not only laboratory confirmed cases of COVID-19, but what we call a probable case of COVID-19. This will have impact on the number of cases that we're reporting. A probable case is someone has been exposed to someone who is laboratory confirmed and who has disease, but has not had a laboratory test or has not had a laboratory test at all. So, for example, sometimes in congregate settings like a detention center, when after 4 or 5, 6 mates that test positive, we know that COVID is in the and resources of testing materials and personnel. We will begin cases as probable just based on their known exposure to a known case. So in that way, exactly the same way as if they were confirmed, but it's just sort of that CDC implemented this. So, for example, today we had 724 confirmed and 2 probable cases, but we just lumped them all together. The other thing that's the way the state is classifying deaths going forward, starting yesterday, anyone has a laboratory confirmed result will be classified as died. So that slight change to jump up quite a bit. Friday, 2.7% death rate, and today it's gone up to 4.5. Really a doubling. It's surveillance, the way that we've changed. So that answers your question about our data. To answer your question about what are we doing with the spread in our community, we're adhering to all of the health directives that come out through our national partners control and is through and the state health officer, and then there's that we believe might be important for Mobile, and this message continually out every day at home, to obey the state, come out if you have medical supplies or to care for when you do go out. And this is something we did in addition to this, made a stronger in the face covering.
I think
anytime
that we were having some issues with the doctor's audio, so I'm going to try to get her back in here. And I know y'all are commenting saying that we're having some breaking up issues, and you are right, and that's happening on my end too. So I've just pulled her out there. We're going to try to bring her back in, but while we do that, let me just show you this map that our really talented Ramsey Archibald has made. You can see the coronavirus cases per capita in this map. Now, I'll make it a little bit bigger for y'all, but essentially what you can see here is that the darker the color, the more cases that or the worse the outbreak is, rather, in that county. Now, that means not necessarily the case number, but per capita. You can see that Chambers County is that darkest purple color there on the left side of your screen. But you can also see that Mobile County down there is also getting a little bit deeper of a pink color as well. So this is just, again, some really interesting data that you can see on AL.com that is from our Ramsey Archibald. And he created this map. He's keeping it updated, and he is going to continue to keep that updated for us and make sure we get the latest numbers there. Now, a little bit of information about Mobile. I'll take off this graphic because she is obviously not with us right now. It is, you've just got me. But the things that Dr. Murphree was saying, and again, we're trying to dial her back in, but Mobile County has been seeing a really rapid increase in their coronavirus cases. Now, we were just talking before I cut Dr. Murphree out to try to get her connection better, that Mobile reached 710 confirmed cases on Tuesday afternoon. Now, Dr. Murphree, who's an epidemiologist and who is the bureau chief at the Mobile County Health Department, she was telling us before I cut her off her audio, that this morning, as of this morning, Wednesday morning, the county is seeing 726 cases. So that's a little bit of a rise from the 710 from yesterday. Now that 726, she said of those, there are 724 confirmed and 2 probable cases. So they've just lumped them together into that 726 number. And we're, again, just, that's the numbers that we're getting. We had the 710, and Dr. Murphree gave us that 726 number as of Wednesday morning. If you were watching our channel earlier, you saw that our reporter Chris Harris went down to a barbershop in Mobile that had reopened, even though there are these restrictions going on that is not allowing them to do so. Feel free to go back and watch that whenever I'm done here. And that'll give you a really good insight of what's happening in Mobile with the people there and what kind of things they are experiencing on the ground. Now, I'm looking at some of your comments. Well, if somebody says she was your microbiology teacher, it sounds like you had a very informative teacher. And let me see if I can pull her back in here. And while I'm doing that, I'll let y'all look at the map again. It's really interesting data, and again, our Ramsey Archibald has been keeping it updated, and it's really interesting to see the outbreak and per capita, how that looks. So while I've got that on the screen, Dr. Murphree, do I have you back? Perfect. Yes, and you are clearer looking for us, and I can hear you better as well. So great. I'm so glad we got you back. You got some shout outs from some students you might have had before. So
I heard that. Yeah. Back in the day, I was a graduate teaching assistant for the microbiology classes at Jacksonville State University when I was working on my master's degree. So that is definitely a throwback.
Well, you got some blast from the past people on our comments. So I'm so glad we got you back. I'm so glad your audio is better and we can understand a little more of what you were saying. But I was talking about how before we lost you, you were saying that 726 number includes 2 probable cases. So that's 2 probable is a pretty low number compared to 724.
Right.
So how are these probable case numbers calculated? And you said you're just lumping them all in with your total.
That's right. We just combine them as COVID disease when we report out. This is something that just started this week, so we expect that the number of probable cases will go up. It's a surveillance classification only. We don't treat these people who have disease and have been exposed to COVID, but they just did not have a laboratory test. That's who fits in the probable case definition. So you're sick, you were around someone who had laboratory confirmation, but you're not able to get a lab test yourself. So we classify those as, a probable case of COVID-19 and treat them just the same as we would a laboratory confirmed case when it comes to surveillance and when it comes to the advice that we give them about staying at home and remaining in quarantine and those sorts of things.
And why would those people not be able to test? Is there an issue with the test being available, or of that person or that patient not being able to physically get somewhere to get a test?
Well, sometimes what we do is we may recommend not testing people if we know that COVID is in an environment like a detention center or a nursing home, and we have maybe 5, 6, 10 positive tests already. We can just conserve, limited medical supplies by not continuing to test people and not continuing to require PPE to test people and classify them as probable instead, and save those test materials for when we might have cases pop up in a new area.
I know that before you have been asked that and said that you did not consider Mobile to be a hotspot. Do you still feel that that is the case?
Well, we're definitely seeing an increase in the number of cases, and our incident rate is increasing as we are, able to test more people throughout the county. So I'm not surprised that it's rising. When I look at, I think it's important to remember that what you see in most presentations of the data is the report date. So the date that the laboratory report was made, and that is influenced by a lot of things like how quickly they could get to the doctor, how quickly the test could be done, when was it reported back. So early on in the outbreak, we had delays in reporting for 7 to 10 days sometimes, and so that case wouldn't be counted in sort of near real time. And what we're seeing now is that we're able to count them more in real time within a day or two of them being tested, which is probably why we're starting to see us catch up to what our real incidence probably is.
Has the county been able to pinpoint any event or location for this sudden spike in cases, or even just sudden testing and seeing that people do have it? Could that be attributed to beaches, to Mardi Gras, anything like that?
Not to those things, but we have outbreaks going on in 4 or 5 nursing homes here. And one nursing home in particular has had an enormous number of cases in both their residents and in their healthcare providers. So I think from that one location, we've had, over 75 cases reported just from that one congregate setting. And so that definitely increases our numbers. It's a little bit challenging. We don't want to, when we have outbreaks within the big outbreak, they definitely can influence our numbers artificially or make it look maybe worse than it really is in the community. But right now, I think we're okay with just putting everyone in the same bin and counting them that way. The important thing for me as an epidemiologist is that when I look at the breakdown by age and by sex and by race, those percentages don't seem to be changing much. They seem to be stabilizing. So I feel like we have pretty good insights on the age groups that are more highly affected, the sex, what the sex and race looks like of our cases, and the proportion hospitalized. That does not seem to be changing much. It seems to be pretty stable. So yes, our case count will continue to rise. We have not been getting our daily number of reported cases is much lower this week than it was 2 weeks ago. A couple of weeks ago, we were seeing 71, 75. Let me look at the chart. We were getting, a much greater number of cases reported to us each day than we are now. So yeah, back on like April 7th, 8th, and 9th, we had 71 reported on this April 7th, then 64 the next day, then 70 on the 9th. And now we're seeing between, 20 and 50 or so cases reported each day. So some of this is just a surveillance artifact that we are adjusting to. What I try to look at is how are the cases trending with regard to the onset of their illness, because that is a truer representation of how community transmission is happening. As you get exposed, you generally become ill within 14 days. And so as an epidemiologist, I look at the illness onset date. The thing that makes that a little bit difficult is that we know now, we didn't know this a month ago, but we know now that we have people who test positive and don't have any symptoms at all. And so it's a struggle to decide sort of how to deal with those and consider those asymptomatic laboratory confirmed patients when we're trying to determine what the spread looks like in our community.
It's funny. This was actually a question I had from one of our reporters, so I was going to ask you, but then one of our commenters on Yiki, I'm sorry if I mispronounced your name. Sorry, because I'm also a victim of that all the time. But she has asked, and again, one of our reporters has asked, do you think that Mobile County has reached its peak yet?
It's a hard thing to answer. This week, everybody said this was going to be the peak according to the IHME models, and that this was going to be it for Alabama. It very much feels like that. The cases are not trending that way. The cases to me look more like um, that we may be that the public health measures that we are implementing may be slowing the spread down, or maybe flattening that curve a little bit. So I'm not sure that we have peaked. What I'm very concerned about is that we too soon lift some of the public health measures that have been implemented that seem to be having the effect that we intended, which is slowing community spread down. The the risks, if we are flattening the curve the way these measures are intended to do, and if we are slowing community spread in order to not overwhelm our hospitals and our healthcare facilities, then we need to continue doing those while our hospitals prepare for a potential second wave or potential third wave. So that's what I'm most concerned about, that because people are getting restless at home. Couples are probably starting to bicker. Children want to go back to school because their parents are driving them crazy. The natives are getting restless, including me, and I just worry that people are going to want to have those public health orders lifted, and then we're going to see a sudden rise in cases again. That's what sort of keeps me up at night. I don't have a model for Mobile County that can predict or can show me when we might be peaking in Mobile County. I just continue to look at those state models and the national models that are out there. And, they're only as good as the science and the assumptions. I compare it to predicting the path of a hurricane. Everybody in Mobile knows what a challenge it is, and everyone is out there trying to predict. The hurricane might strike anywhere from New Orleans to, Tampa, and that's a wide area, and we almost never get it perfectly correct, but still the information, as imprecise as it can help us make decisions.
That's great. You made some great points there, and I think that's a conversation that's happening nationally, and something that national experts are like you, saying that is what's keeping them up at night, is this rush to reopen, this rush to get back to normal, or our new normal, if there ever was a normal. And that is something that everybody's got concerns about. Now, kind of looking forward, we talk about this normal. Something for me, I know when life does return, I can't wait to get back to restaurants, because I'm very tired of cooking. I'm sure my husband is very tired of my cooking as well. So something Mobile City Council hinted at looking into an ordinance that requires food handlers to wear masks, gloves, and other protective equipment. Do you think that is something that the health department should consider as a county-wide health order, or is that something that cities should look to for city ordinances?
Well, we've already said that the Mobile County Health Department has already recommended that the food handlers, in addition to the requirements that are already put in place for them through their food licensure and inspection, that they consider wearing gloves when they're providing curbside or pickup services, that sort of thing, as a precaution, and also as a protection for the people that they're serving. I think that we are working under unified command in Mobile County, so the state health officer and the mayor's office and the county commissioner are talking every day to discuss the ideas that the three of them have about trying to implement new measures, or talk about things that maybe aren't working and need some more strength to them. So there are things that we discuss, like what you're suggesting that the mayor has been talking about. So our principals will get together and talk about it and make a decision. And if it's something that is supported by our state health officer, then we can certainly issue a health order. But again, we're talking and considering those things in conjunction with the health department, the mayor's office, and the county commission.
When you talk about reopening, has the health department given any guidance on summer camps, or are you still in kind of a wait and see mode?
Well, right now, under the state order, summer camps are not allowed. unless they can accommodate 11 or less children in one room with one teacher. Under that definition, they could potentially still have a camp as long as they could support, social distancing and not gathering in cafeterias or in play spaces or in indoor spaces. So there's not a moratorium on summer camps per se, but just that state health order that restricts childcare and daycare to only 11 students and one teacher per room.
This May 1st date has been something big on everybody's minds. It's been something that I think has really, like you said, getting these those stir crazy among us to that line. Do you think that we are ready to lift these restrictions by May 1st?
I don't, I'm convinced that it's not the right time to lift every restriction on May 1st. It's not going to be sort of a flip of the switch and where, on the 31st of April on lockdown and on May 1st, everyone can just start moving about as normal. It will definitely be a staged approach. Some people call them phases, some stages, but, as we got into the state that we are now, we first had social distancing implementations, and then we limited gatherings to 25, and then we limited to 10, and then we said stay at home, and then we said face covering. So these things did not come upon us all at once, and they won't be lifted all at once. So it will be hopefully a very thoughtful, staged return to normal, and you will see these staged restrictions. We still are very, very concerned about our most vulnerable populations. So it is likely that younger, healthier age groups may be able to move about more freely than our populations that are older or have underlying conditions that might make them more vulnerable to severe complications. So those are the conversations that are being held, in every boardroom across the U.S. right now at the local, state, and national level.
Is there anything big that affects Mobile County that I've forgotten, or anything else that you want our audience to know?
Well, that's a good question. I'm not sure if we talked about it in this. We have heard from Walmart corporate that they are going to open a drive-through testing facility. It's probably going to be in the Saraland location. Probably will open next week, so stay tuned for that. There's also, some exciting news. We talked about the new LabCorp test that's been authorized that may provide in-home testing under the guide of a physician. So stay tuned for that. I can't think of
things that we talked about before we lost you and had to bring you back. So thank you for reminding us on that. Will you or somebody from the health department be putting that information on your social media pages when those things are available, like the Walmart testing?
Yeah, absolutely. Like I said, I've heard from the leaders of Saraland that it likely will be next week before they are up and rolling, but we will definitely let people know. Also, just remember that if you need to get tested and you have not been able to get tested so far, you can call the Mobile County Health Department at 251-410-MCHD and get an appointment to get tested at no charge to you. At our facility, which is downtown. So that started just this week. And I think that's all. We do our 2:30. If you are viewing from Mobile, we are still doing our 2:30 live Facebook update. So you can look at I Love MCHD or find us on Facebook if you want to watch those daily updates as well. So thank you for having us on to talk about what's happening in Mobile.
Thank you so much, Dr. Murphree. We appreciate your time. I know that, again, you're a very busy person, and we know that you've got a lot going on and a lot on your hands down there. So we appreciate you keeping us updated on the county. And for all of you watching, thank you for tuning in, and we will see you tomorrow.